Hello everyone, my name is Dr. Niels Kremers. We are going to present everything you ever wanted to know about medical grade honey. After the session, I hope that you're also convinced about not only the antimicrobial activity of honey, but also the wound healing properties. To start off, here is a post-operative infected wound. The 43-year-old patient was treated for morbid obesitas, and after losing a lot of weight, he got a second surgery to remove excessive skin. The first night following surgery, the wound produced malodor and the gases absorbed green exudate, which after lab testing later proved to be Pseudomonas aeruginosa, which was antibiotic resistant. The wound started to dehisce, and it was a very large, foul-smelling wound with pus discharge. Medical grade honey was applied and covered with a regular absorbent dressing for fixation.
This photo is after 12 days of treatment. But the most remarkable is that malodor disappeared along with the green exudate. After 12 days, the wound was clean, looks much more vital, and lab testing confirmed resolution of Pseudomonas aeruginosa.
1 week later, the wound was primarily closed again. After 6 weeks, the wound was clinically healed. Here we see the result after 3 months follow-up. For me, the most remarkable aspect of this case is that with only using medical grade honey, this antibiotic-resistant bacteria could be fought. Next, our expert will explain why honey works antimicrobial.
I invite you to escape the year 2020 to travel back with me to ancient Egypt when honey research started. I will then highlight the antimicrobial properties of honey and show you clinical cases giving evidence for its wound healing efficacy. The very first piece of evidence of man's relationship with bees is an ancient cave painting in Spain, dating from the Mesolithic period, about 8000 before Christ. Nevertheless, it took until the ancient Egyptian times to find out about honey being used in medicine. The most known written account of its use is from the Smith Papyrus, an ancient Egyptian medical text. The use of honey is depicted throughout history in written publications. In this timeline, we start with the godfather of medicines, Hippocrates. Working our way up to modern libraries like PubMed, we will find journals citing and describing the successful use of honey in virtually any wound, from abscesses and malignant ulcers to surgical lacerations. In a sense, honey is a final product that reflects the health of the bees that produced it and the health of the environment the bees produced it in. Honey, produced close to industrial areas, generally is not clean. This means that honey to be used in patients must fulfill defined quality criteria, such as being free from biocides, pesticides, toxic heavy metals, and antibiotics. We also know that honey has been associated with botulism. Despite being rare, this is an unacceptable risk. So honey must be sterilized and free of Clostridium spores if it is to be applied to wounds. The only proven way to destroy these spores is through gamma radiation. If other conventional sterilization methods, such as heat, are used, then the valuable enzymes in honey will denature and the potency of honey will be lost. Talking about honey, we are dealing with a very unique natural substance that is made up of almost 200 components. So we are still far away from deciphering its exact mode of action. I want to highlight the antimicrobial aspect of honey because it is one of the biggest points in research, making honey so fascinating. Honey's potency is based on an acidic pH, which is not ideal for most pathogens, a very strong osmotic effect, which is essentially removes the water necessary for living organisms, an intrinsic enzymatic activity that yields hydrogen peroxide, which is bicidal to many pathogens as well. The amount of hydrogen peroxide accumulating in honey is reported to be 1,000 times lower than that associated with the 3% hydrogen peroxide solutions. Hence, the levels of hydrogen peroxide found in honey are deemed to be non-toxic. If you recall that with antibiotics, the resistant clock starts ticking on them as soon as you start using them, and you add to the fact that honey has been successfully used since ancient Egypt, then you will come to the conclusion that honey effectively has the best track record in medical history since no resistance has been reported to date. And so it happens that it's actually effective against numerous strains of bacteria that have acquired resistance to antibiotics, including the notorious hospital strain MRSA. This antimicrobial capacity has been tried and tested in vitro through time and has proven over and over again to endure. The graph shows that at low bacterial concentrations, L-Mesitran and Manuka are relatively the same, but at a high infection on the right side, one needs significantly less L-Mesitran to get the bacterial load reduced. In short, Manuka is less effective than L-Mesitran in killing bacteria. That means one needs only 20% medical grade honey contained in L-Mesitran versus 40% medi-honey in Manuka for a bactericidal effect. This is an evidence for the importance of the supplements. Similar results were obtained against Pseudomonas. The graph shows that at low bacterial concentrations, L-Mesitran is more effective than Manuka. And this is continued at high infection on the right side. L-Mesitran is consistent in its performance and one needs less L-Mesitran to get the bacterial load reduced. In short, Manuka is less effective than L-Mesitran in killing bacteria. Healing processes can be delayed by several factors such as aging, malnutrition, and other forms of immunosuppression, which lead to an imbalance in homeostasis, resulting in oxidative injury. Antioxidants are fundamental in balancing the amount of reactive oxygen species, which tend to rise, particularly in the inflammatory phase, and hence allow for wound progression. Vitamin C is well known as a cofactor in the biosynthesis of collagen and improving tensile strength in skin. It is also an antigenic agent. By combining the existing knowledge on honey as a wound healing agent and with the known benefits of antioxidants, we have taken something already great and made it even better. A long history in wound care has shown us that there's an extremely valuable synergy taking place in L-Mesitran, in which the combination of honey plus antioxidants is superior to honey use alone, as we will see in the next slides. As you may know, Malassezia paridermatis is a normal inhabitant of canine skin and ears. Under certain conditions, however, this yeast can be an opportunistic pathogen. Frequently, you isolate it from otitis externa in dogs. A study from Oliveira et al. Revealed that, shown as dotted orange line, pure 40% honey had a minimum fungal concentration of 80%. That is, the honey without supplements killed only 80% of Malassezia paradermatis. Whereas, shown in the blue line, L-Mesitran 10% killed all Malassezia. And that's what we call enhanced antimicrobial action. Hermans et al. Conducted a laboratory study in Candida albicans. They investigated the effect of raw honey compared to L-Mesitran on clinical isolates from women's vaginal candidiosis. Results: 25% L-Mesitran managed to inhibit the growth of Candida albicans, and in contrast, the raw honey component was not effective at the same concentration. 50% L-Mesitran revealed a fungicidal effect. Again, the raw honey component was not effective at the same concentration. Let's now have a look at a video from another expert, Professor Dr. Hilde de Rooster of the University of Ghent.
We gebruiken medicinale honing vooral bij honden en katten die huidwonden hebben. We zijn ervan overtuigd dat wonden meestal niet met antibiotica moeten behandeld worden. De belangrijkste bevinding van het onderzoek is dat honing gaat inwerken op verschillende kiemen. En dus zeker ook op de kiemen die antibioticumresistentie vertonen. Terwijl nu ook weer aangetoond is dat honing die kiemen alsnog gaat kunnen afdoden of minstens hun groei gaan remmen. Waardoor je dus een mooi klinisch resultaat kan bekomen.
Honey is applied on the wound direct or via a gauze. This will fill the wound cavity in all places. Due to the osmotic effect, the underlying tissue will be stimulated. Lymph fluids will be drawn from the depth and keep the wound moist to optimize healing. This will help the debridement of the wound bed. The bacteria in the wound exudate will be killed through the supplements and ingredients in the ointment and the hydrogen peroxide activity. In due course, the wound will granulate and the skin will close. The wound then heals.
So, what have we learned so far? Medical grade honey has a strong antimicrobial activity. It has anti-inflammatory activity. It debrides and reduces malodor. It stimulates wound healing and is a safe and cost-effective approach. Next, some clinical cases from around the world will also be presented to further support these properties.
Da ferida, não ia tanto para casa. Ou ia ao ginásio, ou ia jogar à bola. Passo o dia sentado, depois vou para casa e continuo sempre sentado. Achei que era alguma. Fazer um trabalho ou algo que ia desaparecer. Pôr peso e aquilo não fechava. Foi então que eu vi ao médico e o médico disse que isto eram simples para conhecer ao prato.
Foi a ferida começar a evoluir, porque ela não estava a evoluir com o álcool-cel. Então deu-lhe ali um choque e ela começou a evoluir, que não acontecia nos últimos 5 meses que estamos a fazer agora.
Era difícil porque eu não podia molhar aquela parte, então.
Nela, daquilo que eu tenho visto nas feridas que tenho tratado, na verdade, não tenho infecções, não há sinais inflamatórios, muito bom para desbridar, muito bom para feridas que têm tecidos fertilizados, tecidos mortos que limpam muito bem. Portanto, tem uma solução que não se encontra em outros pensos, muito mais rápida de desbridar do que outras soluções que nós temos no mercado. Porque vimos que o tecido esponjoso mantinha-se e com o mel 40% verificamos que realmente houve um maior crescimento, o tecido aplainou, não houve esta criação de tecido esponjoso e a ferida realmente tem melhorado. Já temos encerramento da ferida na parte de cima, temos apenas uma pequena ferida no topo inferior da ferida.
Tomar a vida normal é jogar à bola.
The past 20 years, we have seen that medical-grade honey has been used in a multitude of difficult-to-heal wounds. Next video will show how easy it is to apply it in pressure ulcers. As you have seen, any type of secondary dressing can be used to cover medical grade honey. Knowing that, it makes the application in difficult cases easier, as will be shown next.
The initial osteomyelitis leads that physician to indicate the amputation. That was the beginning. At that moment, we started the use of L-Mesitran soft gel, but it was controlled every day. I think that the quality of life was really improved because when you rescue the tool, it means very much for that patient. He didn't need special shoes, special devices like with the amputation. One of the greatest advantages that it works antibacterial without containing antibiotics.
One of the biggest healthcare problems in Asia is diabetes. Dr. Apong successfully uses medical grade honey in his diabetic food clinic in Malaysia.
Because we have been making good progress on the wound, the quality of the life of a patient had actually improved. A lot of emotional stress for her because she had already lost one leg. Losing one leg is painful enough. Losing two will be devastating for her. I have been in constant communication with the son, who will take photograph and then send it via WhatsApp to me within that 5 or 6 days before she come to see me next. This case is a special case. When I first saw the wound, I knew that it was mismanaged. She was not given proper chances of advanced wound care before she was offered another amputation. The problem with wound care in Malaysia is there are not that many doctors who are interested in this kind of dirty wound, especially the diabetic foot ulcer. When you offer amputation as the only treatment of choice for that non-healing wound, then something is not quite right there and need to be improved and corrected. With the new product that we have and with the new knowledge that we have, we can actually do more and save more lives.
Dr. Apong led us to a broader research into the application of medical grade honey for diabetic foot ulcerations. The research published in the journal Antibiotics showed that infections can be treated and, more importantly, amputations can be prevented.
Now, what we found basically when you look at diabetic foot ulcers, usually you find that there is slough, there's necrotic tissue sometimes, there is infected wounds, and honey actually helps in many ways. It debrides, it helps us debrides enzymatically, which is an active way of doing it compared to autolytic debridement. And at the same time, basically, it reduces the bacterial load, or actually works as an antimicrobial dressing, cutting down infection, which is a big thing now because you find a lot of organisms are actually coming into resistance. Like antibiotic resistance has caused a lot of problems, especially for patients. So medical grade honey actually helps in that sense. And it acts locally. So instead of putting patients on systemic antibiotics and all that, which might cause more side effects and problems, a local management is very important, especially when we need to cut down the infection and actually help the patient's foot ulcers to start healing. In those two cases, you can see there's a bit of necrotic tissue, number one. Number two, there's also a bit of slough, and you can see there's also, suggestive of a biofilm. That means there's an infective process going on in those cases. So basically, when we used honey itself, we were quite happy with the results. If you can see the post pictures, the wound looks much, much more clean. So therefore, we have eradicated the infection without actually putting the patient on a knife or anything where we cannot control. And in terms of enzymatic debridement, basically, it also, it's very selective. So honey works very selectively on that. And there was also reduction in smell. There's also reduction in the infection rates. So it worked much better. And it cut down actually our usage of any forms of antibiotics, whether intravenous or even orally. You can actually cut down the amputation rates.
I like to take you from the diabetes to neonatal wound care. The past few years, we published 4 publications on PubMed, showing the efficacy and safe use in these delicate patients.
Full-term neonates and premature neonates in ICUs represent a small and delicate group of patients. Sometimes, prolonged hospitalizations are necessary for the well-being of these kids. Intravenous lines are usually placed in position without problems, but rarely extravasation injuries might happen. Extravasation is the unintentional leaking of intravenous administered fluids, such as medication or nutrients, into the surrounding tissue and may subsequently cause skin and soft tissue damage. These extravasation-induced injuries can result in severe ischemia, infection, necrosis, and pain, and in the long term lead to scarring and contractures and functional loss. Treatment with medical-grade honey is a relatively new and novel approach. Medical-grade honey possesses antimicrobial, anti-inflammatory, and antioxidative properties, enhancing wound healing. Even in most difficult cases with deep skin layers impairment, necrotic tissue debridement, and monotherapy with L-Mesitran ointment serve us with the best results. Successful treatment in every case with great functional and cosmetic results and no side effects. We recommend medical-grade honey for treating extravasation wounds and consideration for other types of wounds. In my field, which is the pediatric surgery, I have many different cases that have been treated with L-Mesitran medical-grade honey. One of the most common is the burns area, and you can see an 8-month-old infant with a partial burn at the area around the wrist. We had monotherapy with L-Mesitran medical-grade honey from day 0, and in 12 days we see the full healing with a medical result very acceptable and a full cosmetic acceptable results as well. The second case is about a 13-year-old girl which presented an ulcer following an abscess removal at the axilla area. We see that we have perfect granulation, tissue, and a full healing at 30 days period. One of the most common cases is the dehisced wound following appendectomy. In 14 days period, we see that the 9-year-old boy had a full healed area. One of the difficult cases was that with a boy that been operated in a different institution. It was an oncological case, and the infant presented with the dehisced surgical wound. So it was very difficult to operate again this child, and we used the L-Mesitran medical grade honey, and we see that in 18th days we have very good result. In 9 months period we have a fully acceptable cosmetic result. Some severe injuries, one is a congenital ulcerated hemangioma at the buttock area. We see how the child presented a female 8-month-old baby at day 0 and at 69th day. Another case was a 9-year-old girl with a large necrotic extravasation wound. This child was a quadriplegic child hospitalized for a prolonged period in pediatric intensive care unit, and this child presented this large necrotic extravasation injury, which was debrided, and then the L-Mesitran grade honey give us the opportunity to have this difficult trauma healed in 30 days period. And as a conclusion, we are going to say that there are no strict criteria for medical grade honey, so we can use it wherever actually we see that there is a trauma or an area that we need better improvement of our healing. The medical grade honey has antimicrobial activity, and this is well documented. The antimicrobial properties of the honey are enhanced by its supplements, which are the vitamins C and D. There is a prophylactic activity that is also well documented by L-Mesitran medical grade honey, and we are sure that promotes good healing and gives us a better cosmetic results than otherwise. Thank you very much.
In this presentation, we hope we have convinced you about the importance of using an approved medical grade honey product. Medical grade honey has strong antimicrobial activity, including against antibiotic resistant strains. Supplemented medical grade honey has stronger antimicrobial activities. Medical grade honey is safe and easy to use.